Okay, good evening, everyone. I hope my voice is audible to each one of you. Yeah, Rimsha, Abroad Medicos, Prikshit, Sonu, Anushka, Hitesh, Kasim, Pranjal, Anmol, very well. Welcome to the session. Please let me know if my voice is audible to each one of you right there. You are able to see me. Um, if you continue to be like regular, then I'm assuring you I will complete the topic within like 3 4 days, 5 days max. Tanya, good evening. Pranjal, good evening. Samir Khan, I'm very much good, beta. I hope the audio visuals are everything fine, guys. Please just let me know if like you are ready with the session, you are ready to take the session. Please just give me a thumbs up in the chat box. Yeah, Gayatri, Abhi. Okay, Anushka, Chaman, Hitesh, Shakib. Okay, okay, okay. So, guys, today I will be starting with the respiratory physiology. Okay, I'm going to start with the respiratory physiology today. So, put the heading as respiratory physiology. Now, since I have to start the physiology of respiration from basics, from starting, so the very first thing that I will be discussing with you guys, it is the lungs airway generation. It is the first topic that we will be discussing. That is the lungs airway generation, or it is also called as Weibel's generation of lung airways. It is also called as Weibel's generation of lungs airway. Now, what is it? Now, this is something which is referred to as the functional anatomy of the lungs, where I will be talking about the trachea, the bronchi, the bronchioles, the terminal bronchioles, the alveolar duct, and the alveolar sac. So, we are going to draw a diagram, and after that, we will see how it is like connected to the physiological aspect. So, this is our first topic. Okay, Sheikh Umair, perfect. So, yeah, just give me a thumbs up, guys. Everything is fine, I suppose. There is no audio, video problems, right? I think it's audible, visible. Everything is like clear, right? So, yeah, we are going to start with the airway generation today. Okay. So, now everyone knows that the respiratory system it is started from a structure that is called as trachea. It is started from a structure that is called as trachea. Now, yeah, it is started from a structure that is called as trachea. Now, this trachea divides. Now, this trachea divides and it forms bronchi. It forms bronchi. Okay. Rimsha, Anushka, Sanya, Gayatri, Tanya, very good. Now, this trachea divides and it forms bronchi. Now, Weibel's generation of lung airway has 23 generations. How many generations? It is having 23 generations. It is having 23 generations. Now, these 23 generations are basically called as branchings or divisions. These are called as branchings or commonly called as the division. So we have branchings or divisions. Now, starting from zero, at zero level, okay, what is there? At zero level, we have the trachea. Okay, moving ahead, we have one. At level of one, we have bronchi. At level of one, we have bronchi. Now, these bronchi will further branch. These bronchi will further branch and you can very well see that. So these bronchi will further branch, and later on, later on, these bronchi will form bronchioles. These bronchi will form bronchioles. So we have trachea. The trachea branches into bronchi, and these bronchi further branches into bronchioles. Okay. So we have up till level of 2, 3, and 4. These are the bronchioles. These are the bronchioles. Now, till level of 16. Now, till level of 16, what you will have, these bronchioles will end, and this is something which is called as the terminal bronchiole. Now they will further end, okay, from 5 to 16, and later on it will be called as terminal bronchiole. Terminal bronchiole. Now we have trachea. Trachea branches into bronchi. Bronchi further branches into bronchioles, and these bronchioles will end into a terminal branch that is commonly referred as the terminal bronchiole. This is something from 0 to 16. From 0 to 16, it is referred as the conducting zone. It is referred as the conducting zone. Now, when I say conducting zone, it simply means that it is allowing the air to go inside the lungs. It is help in it is helping in conduction. It is helping in conduction. Whatever air you are taking in from the tracheae, it goes into bronchi, from the bronchi into bronchioles and the terminal bronchioles, and later on into the respiratory part. So this is referred to as the conducting zone. Yes, Ayan Sakib, yes, it is referred to as the conducting zone. So if we say that we have 23 generations, the 16 generations, the 16 generations are basically referred as the conducting airways. They are referred as the conducting airways. Why? Because they conduct the air. They conduct the air. So the 16 generations are referred as the conducting airways. Why? Because they are conducting the air. Right? Now, I hope till here everything is clear, guys. Just give me a thumbs up that till here everything is clear. Just give me a thumbs up. Meanwhile, I'll just be writing one more point over here that terminal bronchioles, these are the airways. These are the airways where conducting airways end. Where conducting airways ends. Okay. Now this is the point where the alveolar airways will begin. Okay. Terminal bronchioles are the end points. Okay. These are the terminating points, or these are the transition points from where the alveolar pathway will begin. Okay. From where the alveolar pathway will begin. So I hope this is clear to each one of you. So yes, Gayatri, Prikshit, Sonu, Vikas, guys, please try to answer. If you have just done with this particular part, just give me a thumbs up so that I can move on to the next part as well. Hmm. Yes. Yeah. Now, I will continue the diagram from the terminal bronchioles. Please आप diagram को उसी way में बनाइएगा बिल्कुल straight. ठीक है मेरे पास space नहीं है तो मैं next page पे बना रहा हूँ. So we are very well aware that we have already discussed about the terminal bronchioles, and these terminal bronchioles are at which level, guys? This is at level 16. Yeah, okay, these are 16 generation. or at 16 parts. Now, what will happen? The respiratory pathway will begin now. Earlier, it was the conducting pathway. Now, the respiratory pathway will begin. Now, in the respiratory pathway, now these terminal bronchioles will further divide. Okay, these terminal bronchioles will further divide, and this division it is called as respiratory bronchioles. Respiratory bronchioles. Now, at the level of 17 and 18, it is respiratory bronchioles. At level or at 17th and 18th generation, it is respiratory bronchioles. It is respiratory bronchioles. Now, further, these will form certain ducts. Okay, these will form certain ducts, and these are called as alveolar ducts, and these are called as alveolar ducts. Now, from 19, 20, 21, and 22, this is something which is called as alveolar ducts. This is something which is called as alveolar ducts. So this is from 19 to 22. We have alveolar ducts. We have alveolar ducts. And later on, at the level of 23, guys, remember at the level of 23, we have alveolar sac. We have alveolar sac. And this alveolar sac, it is at the level of 23, and it is the functional unit of the lungs. It is the functional unit of the lungs. It is the functional unit of the lungs. Now, this pathway, it is commonly called as, okay, this is the transitional, transitional and respiratory zone. It is the transitional and respiratory zones. It is the transitional and the respiratory zone. So, getting clear with the concept, you should remember we have the conducting zone. In the conducting zone, it is from, we have in total 23 generations. Out of 23 generations, 16 generations from 0 to 16. The tracheae, bronchi, bronchioles, and the terminal bronchioles, basically they constitute the conducting zone. And now these terminal bronchioles are the point from where the respiratory or the transitional zones will begin. Then at 17 or 18, we have respiratory bronchioles. Then from 19 to 22, we have alveolar ducts. And at last, we have alveolar sac. At last, we have alveolar sac. So is this clear to each one of you guys? So just give me a thumbs up so that I can start with the notes part. We will write this in form of like small points so that you are well aware with the facts that what we are discussing as of now. Just give me a thumbs up, guys, that everything is clear up till now. All the parts are clear. So this is something that no, these 23 generations are these 23 generations are the ones which are actually helping, okay, or which are divided by a scientist, that is the Weeble, and into many parts. Yes, Prikshit, very good. Sonu, very good, better. Sure. We have 16 generations called as the conducting airways, which conduct the air, and we have the 7 generations. Anmol Ratan, very good. We have 7 generations, which are the alveolar airways, which are the useful airways, which are the useful airways. Okay, useful airways. We have the alveolar airways, which are the useful airways. Vikas, very good. So now, okay, write down 2 3 points. We have 16 generations which are responsible for conducting airways, which are responsible for conducting airways, and these conduct air. These conduct air. Okay. Now this is something which is called as dead air, which is not helpful for any exchange. Not helpful for any exchange. It is not helpful for any exchange. So these are the conducting airways which conduct the airway which is dead and which is not helpful for any exchange. Right? Now, remember, it is also called as the dead space ventilation. It is also called as the dead space ventilation. Okay? The air which is in the conducting pathway, it is the dead air which is not helpful for any exchange. So that's why it is called as the dead space ventilation. It's called as the dead space ventilation. Now, if we talk about exchange, now exchange is happening at the alveolar airways. Exchange is happening at the alveolar airways. Now, the airways that we just talked about, right? So these are the alveolar paths, okay, from the respiratory bronchioles, alveolar ducts, alveolar sacs. So these are something which are happening in the like exchange, right? So conducting airways, it is anatomical areas, okay, like bronchi, we have bronchioles and the trachea. Now these three parts, the bronchi, bronchioles and the trachea, are commonly called as the anatomical dead space. It is commonly called as the anatomical dead space. It is commonly called as the anatomical dead space. It is commonly called as the anatomical dead space. So, summarizing all the points that we have discussed, okay, the trachea, now remember, the trachea, it is generation. Trachea is at which generation, guys? Can anyone tell me? From the diagram, can anyone tell me trachea is at which generation? You are going to answer me. Now, these are the questions that you are going to answer me, guys. Trachea is at which generation? Yeah, Anushka, I'll share the slides in the group. I'm waiting for your answers. Meanwhile, I'll just put another question in front of you. The first 16 generation, the first 16 generations, yeah, Anmol, Kasim, Abbas, Rikshit, Sonu, Vikas, Kumud, very good. The trachea is at generation 0. Okay, 0. The first 16 generations, basically they form the which zone, beta? Which zone? The first 16 generation, they will form the conducting zone. They will form the conducting zone, and which consists of the bronchi, bronchioles, and the terminal bronchioles, right? The first 16 generations, bronchi, bronchioles, trachea, and the terminal bronchioles. Yeah, everyone is right. Pramod, Sanya, everyone is right. Yes. Now, next is 17th to 18th generation. 17th to 18th generation, everyone knows it is the respiratory bronchioles. It is the respiratory bronchioles. Next point, it is 19th to 22nd generation. 19 to 22nd generation, it is alveolar ducts. It is alveolar ducts. And 23rd generation, the last generation, it is the alveoli. It is the alveoli. Okay, it is the alveoli. So these are small MCQs that you guys have to remember. These are like five important parts from the diagram that we have discussed. These are five important parts from the diagram that I have already discussed with you. This is a continuation diagram that you have to like learn. Okay, that is all called as the lungs airway generation. Okay. Apart from this, guys, just try to remember one more important point. Yeah, just try to remember one more important point over here, that volume of the alveolar region, volume of the alveolar region is about 2.5 to 3 liters. That was again a question that has been asked. It is about 2.5 to 3 liters. And gas movement in the alveolar region, it is chiefly by diffusion. It is chiefly by diffusion. Which process? That is diffusion. Diffusion of gases, you already know, movement of substances from a region of high concentration to a region of low concentration. So all the gases which are actually randomly moving, it is basically due to which property? That is by diffusion. That is by diffusion. So volume of the alveolar region, it is about 2.5 to 3 liters, and the gas movement in the whole alveolar region, it is taking place by which process? It is the diffusion. So till now we have completed our first topic, that is the lungs airway generation, or the Weibel's generation of lung airways, the 23, 0 to 16 and 7. And the last one, that is the 23, it is the alveolar sac, which is the functional unit of the lungs. I hope everything is clear now. So guys, just give me a thumbs up that all of you, the things are like pretty clear, so that I can start with the next part of respiratory physiology, that is cilia, smooth muscle, glands and cartilage. Okay, Prakshit Kumar Sonu, very good. Very good. So this is how like we have started with the functional anatomy of lungs. So we have already discussed about the dead zone, okay, and the respiratory zone. The dead zone, that is the conducting zone in which the air is of no use, whereas in the respiratory part it is like for exchange. So now put the next heading as, yeah, Vikas, Sanya. Okay, okay, guys. Please just try to give me responses so that it's convenient for me as well to teach you people. Okay. So yeah. Now there is presence of. Now we are going to discuss the second topic of respiratory physiology. We are going to discuss the second topic of respiratory physiology. Now we have presence of cilia, smooth muscles, glands, cartilage in the airways. Now, whatever airways we have discussed right now, the conducting airways and the respiratory airways, they are consisting of these four important components. Now, we have cilia, we have smooth muscles, we have glands, and we have cartilage in these airways. So whatever airways, whether it is the conducting airways or whether it is the respiratory airways, they are containing these four important structures, that is the cilia, smooth muscles, glands, and cartilage. Okay. Now starting our concepts with the very first one, that is the cilia. Now we will be discussing. Everyone knows that about the new NMC guidelines, the new NMC draft. You might have read the draft, beta. It is up to 65%. It is the clinical based questions, and 25% is like long essay based questions. Means imagine 90% of the paper would be clinical, but only one thing what they have done is they have given 1.5 minutes, I like seconds for like one question. So now the physiology which you have to read, it should be integrated with medicine also, because whatever points that we will be discussing in physiology, it should be clinically oriented, because they will not be asking the simple questions. Okay, they will be focusing the questions more directed towards the clinical aspects. So it is very much essential for you people to know, from starting only, to develop a habit of solving the clinical cases, and for that clinical integration is necessary. So whatever physiology that I will be discussing with you, it will be clinical based. Okay. So although all the normal points will be covered, but along with that, we will have a clinical integration, so that you have an idea of how to master this later on. So first topic that we are going to start, that is the cilia. So this is the second topic in the airways, that what is present. It is now, write down, it is present in generation 0 to 11. You cannot leave physiology, anatomy and biochemistry without the basic subjects. कोई भी subject, medicine, surgery, pedia, ENT, optha, कुछ समझ में नहीं आए. तो इट्स वेरी मच असेंशियल एट दिस टाइम कि आप लोग पढ़ना स्टार्ट करें, और पढ़ना इस तरीके से स्टार्ट करें कि वो क्लिनिकल बेस्ड ज़्यादा पढ़ाई हो. सिर्फ रट्टाफिकेशन काम नहीं आएगा, चीज़ों को समझना बहुत ज़रूरी है. और क्लिनिकल बेस्ड जो भी नोट्स आपको लिखवाए जा रहे हैं, दे आर मोर देन सफिशिएंट. दे आर मोर देन सफिशिएंट. So cilia is present in the generations 0 to 11. Write down, it is like absent in bronchioles. It is absent in bronchioles. Now, for example, if I'm taking this particular cell, or I'll just draw it nicely. Can anyone tell me the name of the cell according to the shape? Can anyone tell me the name of the cell according to the shape? Okay, I will write down this as pseudo stratified dash epithelium. Okay, or okay, anyone? Yeah, anyone would like to answer? Pseudo stratified, it is ciliated. Now, when I say ciliated, it is consisting of certain cilia which is attached to the basal aspect, right? Apex wala portion. Yes, yes, Arsalan, it is very right. It is columnar. So it is pseudo stratified ciliated columnar cells. It is pseudo stratified ciliated columnar epithelium cells. It is a type of a epithelial cell, epithelium cell. Now, everyone knows that this part, okay, this is a columnar cell. Yes, everyone is right. It is pseudo stratified ciliated epithelium cell. Yes, Vikas, Tanya, Prakshit, very good. Kishin Gaur, very good, very good. So this is something which is called as the cilia. There's something which is called as cilia. Now, this cilia, it is actually responsible for movement, right? What is the function of cilia? Movement. Now, the movement of cilia, write down that the movement of cilia, it is basically dependent on a microtubule protein. Now, the students who have discussed general anatomy, general physiology with me, they already know what are microtubule proteins. And one of these microtubule proteins named dynin, it is responsible for the movement of cilia. Okay. Now, this dynin, it is responsible for movement of cilia, movement of cilia. Okay. And this cilia basically it helps to move. Okay. It helps to move sputum. Now, when I say sputum, जो खांसी आती है ना आपको बलगम वाली, तो that balgam, that is called as the sputum part. Now it helps to move the sputum towards the nasopharynx, towards the nasopharynx, towards the nasopharynx. So it is responsible for the movement of cilia. जो भी स्प्यूटम आपके रेस्पिरेटरी एयरवे में आ रहा है उसको नेसोफेरिंक्स तक ले जाएगा. ओके, सो दैट स्प्यूटम कैन बी एक्सपेल्ड आउट. आप बार बार मुंह से जो है बलगम निकालते हो, दैट इज वाई द रीजन, बिकॉज दैट स्प्यूटम बेसिकली रीचेस योर नेसोफेरिंक्स with the help of this cilia. Okay, so that the sputum so that the sputum can be expelled out, so that the sputum can be expelled out. Now, whatever secretions are there, okay, that secretions need to go out of the body, and for that, these cilia basically they generate the sputum to your nasopharynx, okay, and from the nasopharynx it is coming out of your body in the form of sputum. So this movement of sputum is basically controlled by cilia, and these cilia only work when there is a protein named dynin present in it. Okay, when a protein named dynin is present in it. Okay, so that is how the cilia works. So till now everything is clear, guys. Did you understood what is the function of cilia in the respiratory pathway? We are discussing physiology, so you should know what these cilia actually do. They actually carry the sputum part towards the nasopharynx so that it can be further expelled out of the body, right? So just give me a thumbs up that you all are present or learning. Now remember that this cilia, it is also present in fallopian tube, and along with the fallopian tube, it is also present in Hazira, Komod. Okay, perfect, beta. Ishan, perfect, perfect. Along with the fallopian tube, they are also present in sperms. They are also present in sperms. They are also present in sperms. Now, we'll discuss these 2 points in the next slide. We'll discuss these 2 points in the next slide. ओके किशन, सोनू, वेरी गुड बेटा. बाकी सब सो रहे हो क्या? थोड़ा रिस्पॉन्स भी दे लिया करो. सानिया, वेरी गुड. एक थम्स अप देने में भी तुम लोग के पता नहीं क्या हो जाता है. Now, if I say fallopian tube, you know that this is the structure of the female genital tract. This is the structure of a female genital tract. Now, this is something which is called as fallopian tube. Fallopian tube. Meanwhile, guys, just try to answer the question that where does the fertilization takes place in the fallopian tube? In which part of the fallopian tube does the fertilization take place? So I will tell you that this fallopian tube basically contains cells which is called as columnar cells. This is called as columnar cells, and these are something which is containing cilia. This is something which is containing cilia. So I can simply say they contain ciliated columnar cells. They contain ciliated columnar cells. Now what happens? The sperm, the sperm basically it comes, and this is the part. Yes, Kishan, very good. Kasim, very good. Harkesh, Tanya, very good. It is the ampulla. एम्पुला नॉट इस्थमस बेटा, अब तो इस्थमस चेंज हो गया है। पुरानी एनसीईआरटी में ना इस्थमस लिखा हुआ था, तो अब तो सीधा एम्पुला ही बोलते हैं। पहले एम्पुलर इस्थमिक जंक्शन भी था, बट अब वैसा नहीं है। अब डायरेक्ट आपको आंसर करना है एम्पुला। लेटेस्ट अपडेट है, एम्पुला में फर्टिलाइजेशन होता है। द स्पर्म कम्स एंड इट फर्टिलाइजेस द ओवा, एंड व्हाट इज फॉर्म्ड? जाइगोट इज फॉर्म्ड। Zygote is formed. Now zygote is an immotile structure. Zygote is immotile. Now zygote has to travel where? In the uterus. Zygote has to travel inside the uterus. Now zygote तो immotile है, zygote के पास तो पैर नहीं है. So these are the cilia which helps in the movement of zygote to the uterus. पहले था, अब नहीं है, अब सीधा एम्पुला ही बोलते हैं. Yeah. So this zygote, it is basically like it reaches the uterus, क्योंकि fertilization अगर यहाँ हो गई, fertilization अगर यहाँ हो गई, फर्टिलाइजेशन अगर यहाँ हो गई, तो उसके बाद जाइगोट जो बनेगा, इट शुड ट्रैवल द यूट्रस, इट शुड रीच टू द यूट्रस, एंड जाइगोट तो इमोटाइल है ना, इसके पास तो कुछ भी मूवमेंट के लिए नहीं है. सो दीज आर द सीलिया which help in the movement of zygote into the uterus, and zygote reaches the uterus with the help of these cilia. Zygote reaches the uterus with the help of these cilia. Hello. So okay, now if imagine a situation the cilia is not working, will the zygote be able to travel to the uterus? No, the zygote will be deposited in the fallopian tube, and this is something which is called as ectopic pregnancy. This is something which is called as ectopic pregnancy. So how? This is an example, beta, how physiology is linking with gynecology. Okay, how the ciliary proteins are linking with gynecology. So this is how one of the examples, right? So I hope this is clear to each one of you. Now, I will teach you the clinical aspects, the clinical physiology related to it. Okay. So, okay. Yeah. Okay. Done, everyone. So, ready for the clinical part, everyone? So, write down. Okay. This is the symbol of clinical integration or clinical significance. Okay. Now, imagine a situation if dining is absent. If dining is absent. If dining is absent. Now, tell me, guys, सीलिया में जो मोटिलिटी थी वो किस प्रोटीन की वजह से थी? डाइनिन की. अब सीलिया तो प्रेजेंट है, बट डाइनिन प्रोटीन इज एब्सेंट. So will the cilia be able to move? Tell me in the chat box. Will the cilia be able to move? No, absolutely not. Why? Because the dynein microtubule protein is responsible for the movement of cilia. अगर डाइनिन प्रोटीन ही नहीं है तो सीलिया की मूवमेंट भी नहीं होगी. If dynein protein is not there, then the movement of cilia would be not there. So that is something which is resulting in a disease that is called as, yes, no. Kishan, Anmol, Sonu, Kumud, Tanya, very good. It is no. And it results in a condition that is called as immotile. cilia syndrome. It is called as immotile cilia syndrome. Now, when I say immotile, the cilia is present, but it is not having the property of motility. Why? Because the protein which is responsible for the movement of cilia, it is like dynein, which is absent. And this syndrome has a subtype which manifest in the form of a disease that is called as Cartaginer syndrome, which is manifested in the form of a disease that is called as Cartaginer syndrome. Now tell me, the cilia is not working. The cilia in the respiratory pathway is not working. What will happen? The sputum, will it be expelled out? No, it will not move towards the nasopharynx. What will happen? The patient will have respiratory tract infections. Okay, the patient will have respiratory tract infections. So the sputum, whatever the secretions are there, they won't be able to travel to the nasopharynx. And in that case, the sputum will be collected, leading to infections of the respiratory pathway. So that is something manifested in the form of Cartaginer syndrome. So write down that the sputum won't get or move towards the nasopharynx, move towards the nasopharynx, nasopharynx. Now, the patient will have repeated respiratory infections. The patient will have repeated respiratory infections, and that is something called as sinusitis, which can lead to bronchoectasis. Now, when I say sinusitis, now try to understand, guys. When I say sinusitis, sinus क्या होता है? Free space होती है. Sinus basically refers to free space, which is filled with air, which is filled with air. Now, what happens? The sputum, it is not moving out. What will happen? The sputum will connect in this sinus, that is the free space. Now, जहां पर air था, वहां पे अब liquid कुछ जमा हो गया, that is in the form of sputum. So that will something which will manifest in the form of infection of the sinus region, that is called as sinusitis. जो खाली जगह होती है जिसमें एयर भरा हुआ होता है, जिसमें एयर की एंट्री होनी चाहिए, वहां पे अब स्प्यूटम भर गया है, तो पेशेंट को बार बार रेस्पिरेटरी इन्फेक्शन होने के चांसेस है. और दूसरी बात, इट कैन लीड टू इन्फ्लेमेशन ऑफ द ब्रोंक्यूल्स एज वेल, तो उसको हम लोग ब्रोंकियोएक्टेसिस बोलते हैं. Patient can have respiratory bronchial infections as well, so it is also referred to as bronchoectasis. It is also referred to as bronchoectasis. So this is one of the manifestations of the cilia, which is not moving with the help of, like, the dynein is absent, so it can lead to one condition, that is Cartaginer syndrome, in which sinusitis is the major thing that you will be seeing. Okay, the inflammation of the sinuses, and the bronchioles will be inflamed. The bronchioles will be inflamed. I hope till now everything is clear to each and everyone. Okay, Prikshit, perfect. Kishan, Harkesh, Sonu, Sanya, very good. Very good, guys. Perfect. Chaliye. Now let's discuss one more scenario. Let's have another clinical physiological relation with gynecology. Now, in the fallopian tube, zygote will also not move. When the zygote will not move, what will happen? It will lead to a condition that is called as infertility. वो फीमेल पेशेंट कभी भी फर्टाइल नहीं होगी. Why? Because the zygote is getting implanted there in the fallopian tube. Zygote की implantation uterus में होनी चाहिए थी. Zygote is getting implanted in the fallopian tube. So ऐसी female patients will suffer from a very big cause that is called as infertility. The female patients will be infertile, and that's due to the very simple reason those cilia are not moving. So those female will have infertility problems. They have sinusitis, and if suppose males are suffering, so the sperm motility is also due to dyning. Now this dyning is absent. Now what will happen? Sperms will become immotile, or we will have immotile sperms. Now the sperms will again not reach the female genital tract, and this is something which will manifest again in the form of infertility. This is something which will again manifest in the form of again infertility. Yeah, this is something which will again manifest in the form of infertility. So you can see that how like the cilia is an important part of the respiratory pathway. Not along with the respiratory pathway, it is useful for the movement of zygote and the sperms as well. And if suppose they are not moving, the patients will manifest like in infertility also. Okay. So again, cilia has one more importance. That is embryological importance of cilia. Embryological importance of cilia. Now, what role does cilia have in no the baby when it is developing? Baby is in like the embryological stage. Now, the normal rotation of internal organs, normal normal rotation of embryological organs. Okay, embryological organs. Okay, just a moment. I'll write it as internal organs. Anushka, beta, this class is meant for every MBBS student who is willing to study. It's like anyone can attend the session, it's free of cost. Normal rotation of internal organs. Now, normal rotation of internal organs. What is happening? Basically, the heart, for example, it is on the right side initially during the development, but it this cilia actually it helps the movement of these internal organs. For example, heart to more to the left side. Heart is basically two-third left and one-third right. Initially, the whole heart is towards the right. So this heart has to move two-third left, and that movement occurs because of cilia. Now, suppose the cilia is not moving. If cilia is not moving, what will happen? There will be improper rotation of organs, improper rotation of organs that is called as situs invertus. That is called as situs invertus. So it is a very important feature. It is a very important feature of Cartagena syndrome. It is a very important feature of Cartagena syndrome. Basically, the situs invertus clearly means that the heart is towards the right side. Heart is towards right side. Heart is towards the right side. A very important feature of Cartagena syndrome. Okay. So that is the situs inverters. So when I say Cartagena syndrome, when I say Cartagena syndrome, now there is a triad that is happening in the Cartagena syndrome. What you will see, we will have sinusitis, we have bronchiectasis or bronchitis, that is the inflammation of the bronchioles and the sinuses. And apart from that, we have situs invertus. So this is a triad in Cartagena syndrome. Again, repeating, which is not a part of Cartagena syndrome is infertility. Infertility is not a problem that has been manifested. Okay, majorly, basically, these three are the things which is commonly in every, whether it is a female or a male, this triad it is seen. Okay, so it is sinusitis, bronchitis, and situs invertus. That is a triad which is seen in Cartagena syndrome, right? So this is about okay, this is about the normal the very first part that we have discussed right now, that is the cilia. That is the cilia. So just give me a thumbs up, guys, that you have like understood about the cilia part. Okay, you have understood about the cilia part, the clinical integration, the physiological integration with the cilia. Okay, how cilia it's leading to infertility, how the cilia it is leading to Cartagena syndrome, in which the heart is not rotated towards the right side, so the baby will have the heart initially towards from the birth it will be like from the right side. Okay, Kumud, Sachin, Harkesh, Shakib, Kishan, Kasim, very good beta. Sonu, Anushka, Prakshit, very good. Okay, so yeah, Vikas and Mol, Prakshit, perfect guys, perfect. Hazira, perfect. Sanya, perfect. So this is how like things manifest. Okay, things manifest like this only. Now, guys, I wanted to discuss the next part, that is the cartilage. Cartilage, it is okay. We'll write one point about the rest three parts. Okay, so write down the next the B in the second topic, that is the cartilage. Cartilage. It is write down the location. It is only in trachea and bronchi. It is only in trachea and bronchi. Now everyone knows that the cartilage it is present in the trachea. We have tracheal cartilage in the form of tracheal rings. Tracheal rings होती हैं. So cartilage it is only present in the trachea and the bronchi. Write down. Okay. It is absent in bronchioles. It is absent in bronchioles. Okay. It is present up to 11th generation, and it is absent thereafter. After the 11th generation till the 23rd generation, it is absent. So it is only present up to like from 0 to 11th generation. It is only present up to 0 to 11th generation. Yes, Anushka, it is the hyaline cartilage. I've already discussed in the class as well. Yeah. Now coming on to the third part, that is the glands. That is the glands. Glands are only present in trachea and bronchi. We will be discussing this in detail later on. It is only in trachea and bronchi. And the last one, that is the smooth muscles. Last one, that is the smooth muscles. It is maximum in terminal bronchioles. Maximum in terminal bronchioles. It is maximum in terminal bronchioles. It is maximum in terminal bronchioles. So I have completed with the second topic also better right now. It is the presence of cilia, the smooth muscle, glands, and cartilage in the airways. So we have completed two topics. The very first one, it is the lungs airway generation, and the second topic, that is the presence of cilia, smooth muscles, glands, and cartilage in the airways. The airways. So just give me a thumbs up that these two topics are done and like understood to each one of you who are attending the session live with me. So I just need the thumbs up so that I can start with the third topic, that is the types of cells in the lungs. साइटस इन्वर्टस का मतलब है हार्ट जो है आपका दिल जो है वो राइट साइड को है यूजुअली टू थर्ड राइट और वन थर्ड लेफ्ट होता है बट वो पूरा का पूरा राइट में होता है क्योंकि जब इंटरनली रोटेट होना होता है तो सीलिया होता नहीं है सीलिया नॉट फंक्शनल है तो हार्ट जहां बना है वहीं बन के रह जाता है तो दैट इज सम दैट इज मैनिफेस्टेड इन द प्रॉब्लम्स ओके परफेक्ट बेटा प्रेक्षित अनुष्का किशन कुमुद हरकेश वेरी गुड सोनू अनमोल वेरी गुड चल नेक्स्ट हेडिंग डाल दीजिए टाइप्स ऑफ सेल्स हजीरा वेरी गुड put the next heading as the third topic that we are going to discuss for today is the types of cells in the lung. In the lung, we have types of cells in the lungs. Now, the very first one, it is the alveolar epithelial cells. We have the alveolar epithelial cells. Now, alveoli, these alveoli basically they contain epithelial cells which are like of two types. We have type 1 and type 2. We have type 1 and type 2. Okay. So now please show the last slide, Tanya. Okay, beta. You can just take a pic over it. Okay, Tanya, just you can see over here. Yeah. Chal. Now it's okay, Tanya. Done. Okay. Now these alveoli contain some epithelial cells which are type 1 and type 2. So we will have discussion of type 1 and type 2 separately. So write down the very first type, that is the type 1, or this is also called as primary lining cells. This is also called as primary lining cells. Now we will write some important points over here. Okay? So write on the first point that type 1 cells, they form 40% of the total number of cells. Type 1 cells basically they form 40% of the total number of the cells, but they constitute 95% of the surface area, but they constitute 95% of the surface area. Now when I say the no lungs contains a lot of cells, okay, out of those cells, okay, 40% it is what, type 1, and these cells are so big in surface area that majority of the surface area, okay, like amongst all the cells, the 95% of the surface area it is covered by type 1, although it is 40%, but it's so big, so that maximum surface area, that is the 95% of the surface area, it is getting covered by type 1. Write down that the cells over here are joined by tight junctions. They are joined by tight junctions. They are joined by tight junctions. So cells are joined over here by tight junctions. Okay, the cells are like closely no related to each other. Okay, so they are joined by tight junctions. Now, what do these tight junctions? They are tightly packed to each other. Now, what is the geological importance? These tight junctions, write down. These tight junctions prevents the escape of large molecules. They prevent the escape of large molecules such as albumin into the alveoli. Okay, so they don't allow escape, like albumin to go as it is into the alveoli. However, although they prevent they prevent the free passage of macrophages and polymorphs. So these are cellular organisms, okay? These macrophages, okay, the large eating cells, the polymorphic cells. So they allow the free passage of these cells through these junctions. However, they don't allow albumin to go into the alveoli, okay? However, they don't allow the albumin to go directly, right? So this is something about, guys, that is the type 1, or we can say the primary lining cells of the lungs. Is it clear to each and everyone, guys? Just give me a thumbs up, everyone. Hmm, chaliye, let's start. Yeah, polymorphic cells. Yeah, neutrophils. Right, beta. Yeah, Harkesh, Prakshit, Sachin. Okay. So type 1 is done. Like, okay. Kishan, very good, beta. Very good. Mm-hmm. Next, write down the B1, that is the type 2, also called as also called as granular pneumocytes, also called as granular pneumocytes. Now, when I say pneumo का मतलब होता है air, or cytes means cells, and granule, basically granules are pigments. No, now these granules will contain some pigments or something. Okay, we'll learn what they contain. Okay, so type 2, it is also called as granular pneumocytes. It is also called as granular pneumocytes. So now, what is the function? They secrete surfactant. They secrete surfactant. This was the latest question in the last FMG exam. They have asked at which cells of the lungs they secrete the surfactant. Surfactant basically, okay, I will tell you, there is, okay, in general physiology, you might have done with me phosphatidylcholine or lecithin. So they secrete the surfactant, okay, that is the part of the lipid that helps to increase the surface area of the alveoli. Surfactant का मतलब क्या है? Surface area बढ़ाना. Alveoli का surface area बढ़ेगा तो ऑटोमेटिकली आपको पता है जितना ज्यादा surface area बढ़ेगा उतना ज्यादा ऑक्सीजन गेन कर पाएगा. ठीक है, उतना ज्यादा ऑक्सीजन ले पाएगा. So they secrete the surfactant, that is by the type 2 alveoli. Type 2 alveoli, सब बच्चे इसको type 1 मार्क करके आए थे. It is type 2 alveoli. Okay. Now, इसका एक function तो था, they secrete surfactant. They secrete surfactant. Surfactant we'll discuss in detail. After just 2-3 minutes, we'll discuss surfactant in detail. Yes. Now, apart from that, these are the stem cells. These are the stem cells from which type 1 cells arise. These are the stem cells from which the type 1 cells arise. Now when I say stem cells बेटा, आपको पता है स्टेम सेल का काम क्या होता है? दूसरे सेल्स को बर्थ देना, ठीक है, दूसरे सेल्स को जन्म देना, दैट इज द वर्क ऑफ द स्टेम सेल्स. अब टाइप 1 और टाइप 2 में से स्टेम सेल कौन सी है? टाइप 2 ही है. ये सरफेक्टेंट भी प्रोड्यूस कर रही है, साथ साथ ये स्टेम सेल्स भी है. ये बाकी सारी सेल्स भी प्रोड्यूस करेगी, और मेजरली कौन सी प्रोड्यूस कर रही है? दैट इज द टाइप 1 सेल. दैट इज द टाइप 1 सेल. ओके, so surfactant is basically produced by type 2, and stem cells are also type 2. They will give birth to the type 1 cells. Okay, now right on the third point, that they form 60% of the total number of cells. They form 60% of the total number of cells. अब लास्ट वाले में क्या था? They form only 40%. और यहाँ पे देखो, they form 60% of the total number of cells, but these cells are very small, so they occupy 5% of the alveolar surface area. Alveolar surface area, मतलब इनका साइज इतना छोटा है, ठीक है, कि ये सिर्फ कितना स्पेस ऑक्यूपाई करती है? दैट इज 5%. बट है कितनी टोटल? इट इज 60%. इट इज इन टोटल 60% टाइप 2, 40% टाइप 1. टाइप 1 95% एरिया ऑक्यूपाई करती है, टाइप 2 5% एरिया ऑक्यूपाई करती है ऑफ द नॉर्मल एल्वियोलर सरफेस एरिया. ओके, now remember, they do not function in gas exchange. Mark this point and write down in your notes that they do not function. They do not function as in gas exchange. They do not function in gas exchange. They do not function in gas exchange. Okay? They do not function in gas exchange. Now, remember, these cells, they are also involved. They are also involved in pulmonary defense mechanism. Pulmonary defense mechanisms. Okay, because they secrete cytokines and contribute to pulmonary inflammation. Even they are resistant to oxygen toxicity. They are resistant to oxygen toxicity. Okay, and tending to replace type 1 cells after prolonged exposure to high concentration of oxygen. To high concentration of oxygen. Now, guys, remember that these secrete cytokines also. Now, cytokines are something which you will learn in pathology as well. So they all contribute to pulmonary inflammation. Now, when I say pulmonary inflammation, it is inflammation of the lungs. Okay, basically the lung cells. Even if there is oxygen toxicity, these cells have no like they don't get affected by any oxygen toxicity. Okay, even though type 1 is getting affected due to oxygen toxicity, what they will do, they will replace those type 1 cells. Okay, so that like they don't damage the lung. right? So these are the functions of type 2 cells. These are the functions of type 2 cells. So remember, they secrete surfactant. These are stem cells. They form the 60% out of only, like, what is the surface area they are occupying? It is 5%. They do not function in gas exchange. Okay, they are resistant to oxygen toxicity, and they replace type 1 cells after prolonged exposure to high concentration of oxygen. Okay, they replace type 1 um, cells. Okay, okay, Shakib, I'll like see. Okay, okay, I'll not write behind myself. अच्छा, यहाँ पे वो चीज़ present नहीं है ना, मेरा स्टूडियो नहीं है यहाँ पे, नहीं तो उसमें ये चीज़ errors नहीं आते हैं फिर. चलो ठीक है, next time I'll clear it. Okay, otherwise I'll send you the PPT after some time. Okay, don't worry if there is something you have like missed out, you can just copy it from the PPT as well, right? So I hope it's clear right now to each and everyone about the type 2 and type 1 cells. Okay, so just give me a thumbs up, guys, that type 1 and type 2 is clear. So that some more points, some clinical relevances I wanted to discuss with the type 2 pneumocytes and surfactant. Then I'll start with the third topic. Okay, I'll start with the third topic. First, I will discuss about like one drug that is important over here. Yeah. Okay. Chalo. Very good. Sachin, Harkesh, Anushka, very good, very good, very good, guys. Kasim, very good. Prakshit, very good, guys. Chalo. Okay. Now, students, remember that focusing on some important aspects, clinical aspects related to this particular thing. Okay. Remember that anti-cancer drug that is called as bleomycin, and one more drug that is called as anti-arrhythmic drug. Anti-arrhythmic drug that is amiodarone. Amiodarone, which is iodine containing. Now, when I say anti-arrhythmic, arrhythmia, you will study with me in heart physiology. You will study with me in heart physiology. Anti-cancer drug bleomycin and anti-arrhythmic drug amiodarone. These two results in, if a person is taking these two drugs, or if a person is taking like suffering from cancer of the lungs, okay, um person is actually taking these drugs, bleomycin, or person is suffering from arrhythmia, that is the condition, irregular heartbeat. So person is taking these two drugs have a side effects that is simply manifested in the form of, it results in decrease in the type 1 cells. It decrease in the type 1 cells. So everyone knows that over here the type 2 cells will again act as stem cells and produce it. Type 2 cells will, okay, can act as stem cells over here, can act as stem cells over here. So the type 2 cells can act as stem cells over here, and they will again produce these type 1 cells. So any patient who is like taking these drugs, and if the examiner asks you, now integrate pharmacology with physiology and with medicine, guys, how simply the question will be like, a patient is on an anti-cancer drug bleomycin, and what physiological manifestation will be seen in the patient, which cells will be decreased, type 1 or type 2? It will be resulting in the decrease of the type 1 cell. Okay, it will be resulting in the decrease of the type 1 cell, right? So that is something you have to relate and understand. It's not about physiology, it's about clinical physiology, the medical physiology which is ours. So yeah. Now, now when I say type 2 cells or type 2 pneumocytes, when I say type 2 pneumocytes, pneumo means air and air cells, basically the type 2 air cells, basically these cells basically they contain something called as lamellar body. They contain something which is called as lamellar bodies, in which what is present, these are storage bodies of surfactant, storage bodies of surfactant. Okay, and these lamellar bodies are only associated with type 2 pneumocytes. These are only associated with type 2 pneumocytes. These are only associated with type 2 pneumocytes. So just give me a thumbs up, guys, in the chat box. Okay, just 1 minute. I'm coming. I'm just drinking water. Just coming in 1 minute. So yeah, I'll continue with surfactant now. So I have completed with the third topic. That is the types of cells. It is not completed yet. Okay, it's a subtype of third topic, types of cells. I will continue after this surfactant. Surfactant is an important topic that needs to be discussed in the physiology as well. So yes, we are going to start with surfactant now. Just in 1 minute. So yes, welcome back. Just give me a thumbs up, guys. Start. Everything is like ready. वेलकम बैक ऑल माय डियर वंस। एनएमसी का तो नया ड्राफ्ट आ ही गया है ना, तो अब तो पढ़ाई शुरू कर देनी चाहिए तुम लोगों को, और अब तो पढ़ाई ज़्यादा करनी चाहिए कि आप लोगों को ये तो पता चल गया है कि अब जो आप लोग पढ़ रहे हो दैट इज़ मतलब जिस हिसाब से आप लोग अभी तक तो कुछ पढ़ ही नहीं रहे थे, अब ड्राफ्ट आया है, सो आप लोगों को पढ़ना स्टार्ट कर देना चाहिए। इट्स हाई टाइम नाउ गाइस कि आप लोग को सब कुछ पढ़ना चाहिए। अब वैसा माहौल या टाइम नहीं रहा कि आप 5 महीने पढ़ोगे और एग्ज़ाम क्लियर हो जाए। अब तो वैसे भी 1 साल के बाद 1 साल एग्ज़ाम आ रहा है। तो इट्स वेरी मच एसेंशियल कि आप लोग अभी से पढ़ना स्टार्ट कर दीजिए। थोड़ा-थोड़ा ही पढ़िए, बिकॉज़ आपको पता है इतनी सारी चीज़ें होती हैं। पूरा-पूरा दिन मुझे भी पता है आप लोग कितनी पढ़ाइयाँ कर रहे होते हो, स्पेशली द फॉरेन ग्रेजुएट्स, कि हाउ मच सिटिंग इन हॉस्टल एंड डूइंग अ लॉट ऑफ वर्क। तो व्हाट इज़ रिक्वायर्ड एट दिस टाइम इज़ कि आप लोग एटलीस्ट 2 आवर्स डेली सेल्फ स्टडी का निकालें। अगर 2 आवर्स 3 आवर्स खुद से नहीं पढ़ेंगे, चीज़ों को याद नहीं करोगे, नोट्स को दोबारा-दोबारा नहीं याद करोगे, तो कोई फ़ायदा नहीं है। अभी समझ रहे हो, बाद में चीज़ें भूल जाओगे, तो कंटिन्यूअस रिविज़न भी ज़रूरी है। और चीज़ों को क्लिनिकली ओरिएंटेट करके पढ़ना बहुत ज़रूरी है, अदरवाइज तो फिर कोई मतलब ही नहीं है। Getting my point, guys, everyone. So please, it's a huge request to each one of you. Just please start studying. Okay, please start studying. Otherwise, there will be a lot of no issues, okay, later on. I don't want you people to know land up in any trouble later. So it's high time. So please start studying, right? So surfactant is something which is a combination of a fat, that is lipid, and protein. It is something which is in the form of a lipid and protein. Now, this surfactant has two parts, that is the lipid and protein. Uh, it's up to you, Anushka. Like anywhere you can write it. So this lipid is basically the major lipid. Okay, this is the major lipid. Lipid part is the major in surfactant. Okay, lipid part it is the major in surfactant. And which type of lipid it is? Phospholipid. It is phospholipid. And which phospholipid, guys? Remember, it is DPPC. It is dipalmitoyl phosphatidylcholine. It is dipalmitoyl phosphatidylcholine. It is dipalmitoyl phosphatidylcholine. So this is something which is also called as lecithin. It is also called as lecithin, or it is L-lecithin. It is L-lecithin. Okay. Now remember, this lecithin it is the major surfactant. It is the major surfactant, and we have one more type of phospholipid, that is sphingomyelin, which is present in the nerve cell, myelinated nerve cell. Okay, those who have studied general physiology with me, I have already explained about the phosphatidylcholine or L-lecithin or the sphingomyelin. Okay, that is actually the minor surfactant. It is actually the minor surfactant. So the surfactant it is the lipid component, and which lipids are participating, like which lipids are there? It is lecithin and sphingomyelin. It is lecithin and sphingomyelin. Okay, it is lecithin and sphingomyelin. Apart from that, you should remember, guys, that we have okay, we have something which is called as L by S ratio. Lecithin to sphingomyelin ratio. Lecithin to sphingomyelin ratio. So when I say lecithin to sphingomyelin ratio, okay, it is useful for fetal lung maturity. It is useful for fetal lung maturity. Now, imagine a clinical situation. I'm linking physiology with gynecology now. A patient or a pregnant woman of 34 weeks comes to your emergency department with labor pains. Okay, with labor pains, and she is expecting to deliver a baby. Okay, but what is the ideal duration of pregnancy? It is 39 to 42 weeks. It is 39 to 42 weeks. What is the ideal duration of the pregnancy? That is the ideal duration. Now, till 36 weeks, the lungs of the baby get mature. Before 36 weeks, the lungs are not mature, or even if they are mature, I don't know, I have to check it. So now the fetus or the baby, okay, the embryo, it is actually receiving its oxygen from which part? दैट इज प्लेसेंटा। प्लेसेंटा से अपना सारा का सारा ऑक्सीजन ले रहा है जो मदर से कनेक्टेड है। अगर हम बच्चे की डिलीवरी करा देते हैं, बच्चे के लंग्स तो फंक्शनल ही नहीं है, एल्वियोलाई फंक्शनल ही नहीं है, तो बच्चे के लंग्स तो काम ही नहीं कर रहे, तो बच्चा तो मर जाएगा। तो हम बच्चे की डिलीवरी तो तुरंत नहीं करवा सकते इफ लंग्स आर नॉट मेच्योर। तो उस केस में हम लोग एक टेस्ट करते हैं, दैट इज कॉल्ड एज L/S रेशियो। ओके, that is suitable for assessing the fetal lung maturity, that is suitable for assessing the fetal lung maturity। अब उस पेशेंट को सबसे पहले तो हम उसके लेबर पेन्स कम करेंगे, हम उसको प्रोजेस्टेरॉन डेरिवेटिव्स देंगे ताकि उसकी स्मूथ मसल कॉन्ट्रैक्ट करना बंद करे, और उसके बाद हम एक टेस्ट करेंगे बेटा। दैट टेस्ट इट इज कॉल्ड एज द बबल टेस्ट, इट इज कॉल्ड एज द बबल टेस्ट, और it is also called as shake test, it is also called as shake test। now इस टेस्ट ट्यूब में what I will do, I will take the amniotic fluid of that pregnant woman, I will take amniotic fluid। Everyone knows about the amniotic fluid, guys, right? Just say me yes or no, you know what is amniotic fluid. With the help of syringe and needle, what I will take a small amount of amniotic fluid and I will put this amniotic fluid inside the test tube. Now what I will do, I will start shaking this test tube. I will start shaking this test tube, and lipids on shaking will form bubbles. This is something which is known from like the basics कि जब भी हम lipids को shake करते हैं तो क्या बनेंगे, bubbles बनेंगे। अगर bubbles बन रहे हैं तो मतलब लेसिथिन और सर्फेक्टेंट प्रेजेंट है। अगर बबल्स नहीं बन रहे हैं तो L/S रेशियो कम है। तो इसको जानने के लिए एक पैरामीटर होता है, इसको जानने के लिए एक पैरामीटर होता है, दैट इज L/S रेशियो। और L/S अगर मोर देन इक्वल टू 2 है तो फीटस के लंग्स जो हैं दे आर मेच्योर, द फीटस लंग्स आर मेच्योर। एंड इफ L/S रेशियो इट इज लेस दैन 2, it clearly indicates that the fetus lungs are immature, that the fetus lungs are immature, that the fetus lungs are immature। So we have to be clear with the fact कि हम डिलीवरी तभी करा सकते हैं बच्चे की जब बच्चे के लंग्स मेच्योर हो। इस स्टेज पे अगर L/S रेशियो, लेसिथिन जो मेजर सर्फेक्टेंट है, टू द रेशियो ऑफ द माइनर सर्फेक्टेंट, अगर सर्फेक्टेंट है ही नहीं तो लंग्स तो मेच्योर वैसे भी नहीं है, तो उस केस में तो मैं बच्चे की डिलीवरी कैसे करा सकता हूँ, इट्स इम्पॉसिबल, राइट? तो वरना बच्चा तो मर जाएगा। आप कनेक्शन काट दोगे ना, अम्बिलिकल कॉर्ड जो प्लेसेंटा से कटी है उसको तो आप क्लैंप कर दोगे, फिर बच्चे को ऑक्सीजन कहाँ से मिलेगा, लंग्स तो उसके मेच्योर नहीं है। तो उस चीज को टेस्ट करने के लिए देयर इज दिस टेस्ट व्हिच इज कॉल्ड एज बबल टेस्ट, शेक टेस्ट और क्लेमेंट टेस्ट। इट इज आल्सो नोन एज क्लेमेंट टेस्ट। तो एमनियोटिक फ्लूइड लिया, टेस्ट ट्यूब में डाला, टेस्ट ट्यूब को शेक किया, दैट इज कॉल्ड एज शेक टेस्ट। और लिपिड्स जब शेक किए जाते हैं तो दे फॉर्म बबल्स, और उसको पैरामेट्रिक टेस्ट हम लोग बेसिकली रेशियो देखते हैं, दैट इज इफ इट इज इक्वल टू और मोर देन 2 देन द lungs of the baby are mature, we can carry out the delivery after some time and will shift the baby to an ICU, neonatal intensive care unit। but if the lungs are not mature beta, you cannot carry out the delivery। तो उस केस में हमें लंग्स को मेच्योर कराना पड़ेगा, उस केस में हमें लंग्स को मेच्योर कराना पड़ेगा। okay? उस केस में वी हैव टू लाइक carry out the maturity of the lungs। okay, so okay, so that was about, firstly about this lipid part। now coming to the protein part, which proteins are like they produce this, write down, we have surfactant proteins, we have discussed the lipid part, now coming on to the protein part of the surfactant। so we have surfactant protein, and these are A, B, C and D। so you just have to know the name of these proteins, these are A, B, C and D, these are A, B, C and D। later on, now just put the heading as what is the function, we are discussing physiology, so what is the functions of surfactant, what is the function of surfactant? Now the very first function, it decreases the surface tension, okay, it decreases the surface tension। when I say surface tension, it is force per unit length, okay, force per unit length. Okay, it basically uh, the force. Okay, the high force will actually, what will the high force do? It will collapse the alveoli. So it is trying to decrease the surface tension. Okay. Secondly, it is preventing the collapse of alveoli. It is preventing the collapse of alveoli, because more the surface area will be there, more surfactant will there, more the surface area of alveoli will be increased, so that in other ways it is preventing the collapse of the alveoli. Okay, we want more surface area of the alveoli so that more oxygen can accommodate in the alveoli and more oxygen can reach our body, right? Third function, it is responsible for the stability of alveoli as well. It is responsible for stability of alveoli as well. अब्दुल वाहिद, what is nocturnal enuresis? हम यही पढ़ रहे हैं शायद अभी. Very good. It is stability of alveoli. Any personal questions, beta, you can just text me on my number, right? And functions of surfactant, because of two proteins, because of A and D especially. Just remember, these have lung immune function as well. This have lung immune function as well. These have lung immune function as well. So yeah, these are the functions of the surfactant, physiological functions of the surfactant. Is it clear to each one of you guys? सर्फेक्टेंट के दो पार्ट्स, प्रोटीन्स और लिपिड्स. लिपिड्स मेजर होते हैं और लिपिड्स के भी दो, लेसिथिन और स्फिंगोमाइलिन. प्रोटीन्स चार टाइप के, ए बी सी डी, जिसमें से ए और डी दे परफॉर्म द फंक्शन ऑफ इम्यून फंक्शन के काम आता है. बाकी सारा जो सर्फेक्टेंट है डिक्रीज करता है सरफेस टेंशन को. इट प्रिवेंट्स द कोलैप्स ऑफ एल्वियोलाई. इट इज देयर फॉर द स्टेबिलिटी ऑफ द एल्वियोलाई, एंड इम्यून फंक्शंस आर परफॉर्म बाय प्रोटीन्स ए एंड डी, which is like the surfactant protein. So I hope it's clear to each one of you now. I hope it's clear to each one of you now. Just give me a thumbs up, guys, that everything is clear, understood to each one of you. Okay. Now tell me, guys, when you want me to continue the session, today night or tomorrow? Tell me. I'll give you a break right now, but just let me know when you want me to continue the session. Today night or tomorrow? Like, I'll divide the sessions, like there are so many lectures because I wanted to complete things in a very good manner, because notes are very much essential while you are discussing everything. So yeah, I'll be discussing the clinical aspects as well, because general physiology is not going to be asked in exams. It's general plus clinical physiology integrated. Okay, tonight. Okay. We can like discuss at 9 o'clock if you want. 9 or 9:30 we can start with the discussion again in the night, guys. I hope I want your participation in the night as well, guys. If you are like really willing to attend the session, please let me know. It's on your response how I will carry out the sessions, right? So yeah, it's okay. Chale. I hope everything like you understood, guys. So I hope everything is like you understood everything. Okay, beta. Perfect. Okay, bye, bache. Goodbye. And please revise the notes before you know start with the other parts. Okay, goodbye.